We worked with the Carter Centre, with the Department of Mental Health, with the Office of Consumer Affairs and with NAMI and with consumers, and we put together a fledgling early program that evolved into Project Great, which is training tomorrow's healthcare providers in recovery-based psychiatry.
There have been many programs through the country that have been trying to build recovery-oriented services, but we are, as far as we know, one of the first, if not the first, Department of Psychiatry, an academic department that has tried to take this on and to really transform not only clinical services but educational curricula as well.
When I really started in recovery was back when I graduated as a certified peer specialist.
Very often in clinical practice you are seeing individuals in perhaps lowest moments, and we begin to have a certain attitude that people with mental illness are certain kinds of ways. But working with a peer specialist, we see people who are in recovery, people who are successful in their lives, making wonderful contributions to our mission here and having success in their lives. And it makes a big difference in how you think about people with mental illness.
Well, it's a really great job because every day is a little different, and I get to use my whole self, kind of my soul mission of being a missionary of hope to others. I get to talk about my recovery story. I get to share ways that I've been able to recover with mental illness in a way that will help others.
I share my story a lot. I share a lot with people what my experience has been, and they tell me that having somebody who's had shared experience makes a difference, that there's somebody in the room who can relate to what they go through. I've even had residents tell me, I remind them that people get better, and that makes me feel good.
We currently have psychiatric residents that partner with certified peer specialists at national conferences talking about recovery and presenting recovery concepts.
I also get to go on a lot of presentations. I've been really fortunate that Dr. Buckley really supported my travel, and because of that I've been able to spread the word of Project Great all over the country, and especially around Georgia, but also places as far as Seattle, Washington, and Boston, and New Orleans.
At the very heart of the recovery-oriented care is hope. We have made it a part of our entire educational mission, all the way from medical school students to nursing students to psychiatry residents to psychology residents, the whole 9 yards. And including our faculty, because our faculty also need to look at our own attitudes and our own approach to patient care.
This has grown dramatically. We've had not only national but also international context, and I'm particularly proud of our 2 peer support specialists who have reached out and really integrated our program with other national activities.
We feel like it's a very exciting time for our project, and we're so happy that the entire department and university has embraced us as being a vital part of this department and not just a pilot experiment.